5 on your health. October is Breast Cancer Awareness Month, but with all the changes to the guidelines, it can be really confusing for women to know when they should be getting that critical screening. Well, here to help us answer all that is Dr. Sona Chikarmane, our breast radiologist at Mass General Brigham. Good morning, Chikarmane. Thank you for joining us. Let's start with the basics. And the question is, when is the most important thing? What's the most updated guideline on when women should be screened?
So thank you for having me. And that's a great question because the guidelines can be confusing. So the way I think about it is in two parts. I think about when should women start screening and then how often should they be screened? So breast cancer rates have increased in women between the ages of 40 and 45. And now actually 1 in 10 women who are diagnosed with breast cancer are younger than the age of 45. So taking that data into account, the United States Preventative Task Force, which is a national expert of people who determine cancer guidelines such as prostate cancer and lung cancer, have reduced the age to start screening mammography to the age of 40. So we recommend screening mammography starting at the age of 40. The other part of it is how often should women be screened? So screening mammography is the only imaging modality that can reduce your breast cancer mortality. And we know that breast cancers that are found earlier are more likely to be curable. So the Society of Breast Imaging and the American College of Radiology recommend annual screening mammography. That means yearly. Some other societies recommend every other year, but I think the bottom line is starting at the age of 40 and getting annual or yearly screening mammograms, or at least every other year.
Okay, so put that aside for just a moment. What if a woman really wants to be screened and it doesn't fall into the category or the age group? What kind of conversation should she have with her doctor? And are there concerns for getting it too soon or too often?
Yeah, so assessing a woman's breast cancer risk is a really important part of women's healthcare. And so guidelines actually recommend women talk to their healthcare provider, either their primary care physician or their gynecologist, by the age of 25 to determine their breast cancer risk. There's a variety of things that can increase breast cancer risk, such as a family history of breast cancer or genetic mutations or breast density. So we recommend talking to a healthcare provider by the age of 25 because you may qualify for earlier breast cancer screening, including other modalities such as breast MRI. So it's important to talk to a healthcare expert to determine your breast cancer screening regimen.
Okay, thank you so much. Dr. Chikarmane, a breast radiologist with Mass General Brigham. Have a great weekend.
Thank you.